Hi, I'm Brittany Montez, and this is the Orlando Health News Review for January 22nd. We're here at the Dr. Phillips Center for the Performing Arts to celebrate the Our Care Knows No Boundaries event. Community leaders and longtime Orlando residents who've seen Orlando Health's evolution are gathered to hear President and CEO David Strong and Orlando Health Board Chair Brian Basansany share how we have advanced our mission both locally and beyond.
Orlando Health is just such an essential part of the Central Florida community, and so it's great to be here in the heart of downtown at the Dr. Phillips Center to bring community leaders together to give them an updated progress report on all the amazing things that are happening at Orlando Health.
What started as a 50-bed hospital in an orange grove now stretches from the Atlantic to the Gulf, into the Caribbean, and now into Alabama. We're a health system with 25 hospitals composed of more than 6,000 beds, with 5 more hospitals in development. Our system is blessed to have over 36,000 team members and 5,000 physicians. And I am convinced that every award and recognition represents their expertise, their commitment to clinical quality, their desire to serve, and the workplace that they have created and they also sustain. I will tell you, it's humbling to be a part of that work.
And more than 100 team members and their family members volunteered during the U.S. Hunger MLK Day of Service Million Meal Pack at the Orange County Convention Center. This event was part of a collective effort to honor Dr. King's legacy and combat hunger, making a real difference in the lives of those in need. By packaging meals for families facing food insecurity, team members and other community volunteers embodied the spirit of service that Dr. Martin Luther King Jr. championed.
You know, it's always great to get the team out in the community. We got about 100 different team members out here today celebrating Martin Luther King Day.
These meals are being packed today are going to be for the underserved and underrepresented community that we have here locally and throughout the state as well. This means a lot to them, especially this time of year where it's maybe cold outside and they don't have places to get a decent meal. They'll have these pre-packed meals that are going to be distributed to them.
I'm here with my son Maddox, he's 12, and my daughter Parker, she's 10. It's so much fun, the music's pumping, everybody's dancing, having a great time while we're able to give back. Being part of the healthcare community, I feel like we get the opportunity to give back, but this is just an extra way for us to do that. And they don't have school today. It's a great way to honor Martin Luther King Jr. for all the things that he did.
And the community came out to celebrate the opening of the new Orlando Health Lake Mary Hospital. Guests enjoyed games and activities and had the opportunity to learn about the hospital's services, meet the incredible team, and connect with some of our healthcare providers. And introducing Snapshot, a new series of segments highlighting team members and their day-to-day experiences at Orlando Health and in our community. Here's Caitlin to share a snapshot of her day.
Hey, I'm Caitlin, and I'm one of the fellows here at Orlando Health Arnold Palmer Hospital for Children, and this is a snapshot of my day. This is our friendly staff who welcome our patients and triage them for treatment. I'm here at our trauma bay. Let's go check it out. Here we have 4 state-of-the-art beds set up to manage the sickest of the sick patients here in Central Florida. We get over 500 traumas a year, so we're definitely in this room a lot. Here's our fellows break room. Let's take a look. In here, you'll find us catching up on charting, having a quick break for a snack, or staffing a patient with one of our attendings. Over here is our pet wall. This is my dog, Callie. Several of the emergency department doctors, nurses, and staff all put pictures up of their pets to bring a smile to the faces of the patients and families. Thanks for joining me for a snapshot of my day.
And hear the story of Inga, a patient at Orlando Health Cancer Institute.
Inga is a young woman who was diagnosed here at Orlando Health with T-cell lymphoma, and she was refractory. Her disease kept coming back, and there was no other options of treatment.
In that same morning, the doctor called, he walked into my room, and he told me that day that my only chance to survive is to do the bone marrow transplant.
Another hurdle was there was no donors. So the only option for her was what we call double cord transplant. It's a cord of blood that's saved from babies, and these national banks, it's approved by FDA, all these banks are. More recently, we found we could do half-match transplant. You don't have to be 10 out of 10. Cord of blood still has one of the lowest risk of relapse, only 12% versus 30% with other cancer. Ultimately, it's very effective in treating cancer. Not every center do cord of blood, so it's not very common to be done but in her case it works. She got the double cord transplant. She stayed in the hospital for about 4 weeks, and she left the hospital.
It's been a year and a half after the transplant. I'm healthy. I love my family. I live my life. The Orlando Health Cancer Institute, they're amazing.
And here are a few volunteer opportunities to know. Check the Community Relations page on Swift for all the details. That's it for today's edition of the Orlando Health News Review. We'll see you next week.